Good afternoon, chairpersons, ladies and gentlemen. I would like to introduce myself. I am Maj Than Htike Win, a pharmacologist from Defense Services Medical Research Center. May I continue the presentation on the focus of effects of herbs on COVID-19 immunity. Immune regulation is one of the factors in pathogenesis and poor outcomes of COVID-19 patients. There have been many studies with herbal candidates used as immunomodulators. In the European Journal of Pharmaceutical and Biomedical Sciences 2018 review article on the immunomodulatory activities of some medicinal plants, there are 65 medicinal plants which has been investigated their immunomodulatory potentials, in which one of the most popular is tamarisk, scientific name Kagimelongali, Myanmar name Nanui. It is used traditionally in Asian countries as a medicine or supplement. Its extracts contain curcuminoid, which are curcumin, dimethoxycurcumin, bis-dimethoxycurcumin. Curcumin has well-defined and anti-inflammatory properties. Some studies show that the anti-inflammatory effect of curcumin via inhibition on the Toll-like receptors and nuclear fetter cavity activation results in decreased production of interleukin 6, tumor necrosis factor alpha, and interleukin 1 beta. Another study shows that contradictory results. It showed that curcumin had an immunostimulatory effect by increasing interleukin 6 and tumor necrosis factor alpha. Taken together, we can conclude that the results of curcumin administrations are inconsistent because it can increase or decrease pro-inflammatory cytokines. This evidence raises concern about the administrations of curcumin as a treatment for COVID-19. Further and more detailed investigations are needed to clarify the effects of curcumin in the treatment of COVID-19. Next medicinal plant is Java tamarind, scientific name Curcuma xanthorrhiza. Is used as food additives to enhance the flavor of food in Southeast Asian countries. The most common compound in Java tamarind is xanthorrhiza. Xanthorrhiza is specific and can distinguish from Curcuma longa. The study about xanthorrhiza decreased inflammatory genes in adipose tissue, liver, and mast cells in patients with diabetic mellitus. Xanthorrhiza treatment can reduce inflammatory cytokines such as interleukin 1 beta, interleukin 6, and tumor necrosis factor alpha. Another study suggests that xanthorrhiza can increase serum transforming growth factor, which is regulatory cytokines. Taken together, xanthorrhiza can inhibit pro-inflammatory cytokines and promote the production of anti-inflammatory cytokines. So the use of xanthorrhiza may lower the pro-inflammatory response in patients with COVID-19. Name medicinal plants is garlic. Scientific name Alien sativa and Myanmar name Chathampu. Garlic is one of the most used flavoring plants for cooking and traditional medicine worldwide. The major non-volatile sulfur-containing precursor compounds are allicin. Allicin is the precursor of allicin, which are generated during the process of garlic product preparation. Allicin was found to inhibit T helper 1 pro-inflammatory cytokines such as TNF-alpha, interferon gamma, interleukin 2. Other garlic-derived compounds such as caffeic acid, S-align cysteine, and dialyl trisulfide can inhibit the transcription factor nuclear factor kappa B, results in inhibition of the transcription of several cytokine genes involved in pro-inflammatory response such as tumor necrosis factor alpha, interleukin 1 beta, interleukin 6, MCP1, and interleukin 12. This report establishes that garlic is an immunosuppressor rather than immunostimulator. However, whether it has harmful effects must be further investigated in clinical settings. Next plant is ginger. Scientific name Gingiva officinale. Myanmar name Jing. It is widely used as a spice of food flavoring agents and herbal remedy. Garlic is abundant in anti-constituents such as phenolic and terpene compounds. Garlic extracts also inhibits the intention of several genes involved in encoding the inflammatory response proteins such as cytokines and chemokines. Both ethanol and equial extracts significantly inhibit T helper 2 mediated immune response by the decrease in level of interleukin 4 and interleukin 5. Besides, ginger extracts and gingerol can inhibit nuclear factor kappa activation, results in decreased level of interleukin 6 tumor necrosis factor alpha interleukin 1 beta. The next medicinal plant is Echinacea purpurea, a cornflower incommodate Sibyongbanbin in Myanmar. It is a popular herbal medicine in Europe and North America. Many Native Americans use this kind of herbs for respiratory infections. Bioactive compounds like chicoric acid, caffeic acid, alkalamine, and polysaccharide contain. Echinacea, as presented in the figure left side, Bagal et al. Demonstrate that echinacea mediate to increase the release of various cytokines including interleukin 1, interleukin 10, and tumor necrosis factor alpha. It can consider a series of cytokines are liberated in COVID-19 with supplementation of echinacea. Unlike previous studies, Sharma et al. Suggests that echinacea has an anti-inflammatory effect by inhibiting the pro-inflammatory cytokines induced by the virus such as interleukin 6, interleukin 8, and tumor necrosis factor alpha. This report exhibits the inflammatory effect of echinacea as an immunosuppressor rather than immunostimulator. However, whether it has harmful effects must be further investigated in a clinical setting. The other popular Myanmar medicinal plants with immunomodulatory activities are Shazong Lebat, Samone, Sikaji, Nueju, Myogon, and Sindomare. As shown in the presenting table, Shazong Lebat, Samone, and Sikaji has been found to reduce pro-inflammatory cytokine levels, but Sindomare has been found to increase pro-inflammatory cytokine. The other, Nueju, Myogon, can either induce or suppress pro-inflammatory cytokine profile. Based on the previous explanation, I like to conclude that herbal medicine might have the capability to regulate the production and release of pro-inflammatory cytokines. So herbal agents might be useful as treatment to COVID-19. But it is still not recommended to use the supplementation containing one of these compounds to prevent COVID-19. In addition, preclinical and clinical trial evaluations of these herbal agents for COVID-19 have not been specifically conducted, so further investigation related to this is warranted. There are many. These are my references. Thank you for your kind attention. May I invite the next speaker, Captain Htike Win, to present his presentation.